To Inside City Hall, a new report is analyzing last month's budget agreement between Mayor Adams and the City Council, highlighting cuts in social service agencies. And it takes a hard look at the recent union contracts that the Adams administration has reached. The analysis is by the Federation of Protestant Welfare Agencies, a coalition of anti-poverty nonprofits and faith-based groups. It warns that the new budget and cuts to critical programs will affect our city's most vulnerable. Here to talk through a lot of the issues and some of the math, I've got Jennifer Jones-Austin, the CEO of the Federation of Protestant Welfare Agencies. Welcome back to the show. Always good to see you.
Always good to be with you.
So you looked at the budget with a special focus on the human service agencies. One thing that you found is that we're spending less than in the past in ways that are going to harm the city. The agencies that you focused on included DYCD, DFTA, the Department for the Aging, Health and Mental Hygiene, Homeless Services, HPD, Small Business Services. You say that those agencies collectively are getting more than $750 million less than they did in the prior fiscal year. That somehow escaped my notice.
$860 million less.
Yeah.
They're also losing critical staff. And we're doing so. This is happening at a time where they're very much needed. Yes, we may have fewer children in child welfare and foster care, but the need for support services for them isn't waning. When we have so much poverty in the city, when we have so many people struggling to make ends meet, it is these organizations, these agencies, DYCD, after-school services, aging, home meals. When we're talking about education supports, it's these agencies that provide these services. They're going to be needed all the more.
So that number sounds big, $860 million, and it is, but it's 3.5% of the budget, which sounds somewhat in line with what the administration had asked every agency to do, which is to cut their budget by about 3%, right?
Here's the deal. I appreciate that, but what we have to remember is that here in America, we have long, whether it be the Adams administration or other administrations, we have long cut the budget on the backs of people who are vulnerable, people who've been made vulnerable, people, as they say, you cut the budget on the backs of the poor. That's not the way that you should do it. Now, I appreciate that we have a mayor that's got a lot of challenges. I appreciate that he says that the work is not hard. It'd be hard for me, and I understand that he does have limited resources. But when it comes to providing critical services and supports, you can't do it by cutting services to those who are already vulnerable.
I saw in your report a 25% cut to Department of Health and Mental Hygiene, which struck me as somewhat alarming, given the widely understood need to deal with a lot of different mental health crises in
Absolutely, and to deal with them when they are issues before they become problems. So again, I'm going to share that I understand that the mayor has a lot of challenges. The migrant crisis, something that came out of nowhere. It's estimated that it's going to cost the city $4.3 billion in the next year to address that. I understand that. But I also understand that we've got significant monies in reserve. And the last thing that we want to do is to put cuts in place that are going to reduce staff, both in city employee workforce and then in the human service nonprofit agencies on the outside. Not pay people fairly on the outside, because then we're going to have retention issues. And who's going to be there to do the work? The migrant crisis work, the homeless shelter support work. Who's going to be there?
Yeah, let's talk about that. You analyzed how unionized city workers get paid compared to employees of nonprofit agencies that, in a lot of cases, do supplemental or even similar work. You gave the example of a counselor with a bachelor's degree who has a median salary of $39,000 if they're working for contracted outside nonprofit agencies, whereas that same counselor would have a median pay of $60,000 if they're working directly for the government, which is 31% more. On one level, this is like, I think we all knew this, right? I mean, it's better to be a teacher than to be an outside tutor, right? It's better to be a cop than a private detective or something. This is why we support unionized work, right? Is there more to it than that, though?
Well, we may know that, but there are people on the outside, many people who are in need of services and supports, rely heavily upon community-based organizations they can trust. And there are people there who are doing the same jobs as you just said. In the main, they are black and brown persons, 75% of that workforce, black and brown, 70% women, and 60% are eligible for the very same supports, the income supports that they are signing people up for. We have to do better by them. Yes, municipal workers deserve the contracts that they've gotten, but we needed the city to step up and do the same for nonprofit workers. People may say this is old news, the budget has passed. What I want the administration to appreciate is that it's not old news. It's not going away, because services, critical services, childcare, health support, prisoner reentry services. I could go on and on.
Right.
They affect all New Yorkers. So we can't pretend this or say this is old news. We've got to figure out what we're going to do now. The migrant crisis is still here, and they're relying heavily upon nonprofit agencies to meet that need. Homeless numbers going up. They're relying heavily on contracted contracted shelters to meet that need. It's a problem that's not going away.
You know, I lay that reality next to what we've reported over and over again, which is that certain agencies have, 10%, 20% vacancies. Are we sort of shifting a lot of the work over to non-unionized outside nonprofit agencies? Is that what's going on here?
If we're doing it, we're not putting the money in there to support it. These contracts are underfunded. People are underpaid. And even if you think you're going to shift it over there, if you're not going to pay people adequately and fairly, they're going to get up and they're going to walk away.
Yeah. Another budget priority that you flagged is that the budget failed to put in about $500 million to expand free preschool for 3-year-olds, the 3K program.
Right. Well, that's an issue that's near and dear to me, having been a lead advisor for the prior administration on the build-out of full-day universal pre-kindergarten, also having done some of that work with the Bloomberg administration in years prior. The reason that we start children in 3K is because we understand that children, and you know this, I know this, that their minds are developing. Sure. Cognitive development is critical in those early stages of life. And there are many families who were struggling, trying to decide whether or not they were going to pay the rent, pay for food, or pay for critical child care supports. And this was a way to create a universal program where children's needs would be met. And so that's a real difficult pill to swallow. Again, I understand that the mayor has had to make some very difficult choices. I just would prefer that we work together to figure out how not to do it.
Yeah.
And and hurt people who are most vulnerable.
I know that there are people in his administration. I've talked with several of his deputy mayors. They're aware of this. Like, they know they have to get their hands around a lot of these problems, and that cutting funding for certain of the priorities you've identified is not going to get them where this city needs to go. What's the process by which we try and fix this? Because we've got this looming bill that's going to come due for the migrants.
We've worked with several of the deputy mayors. They are well-intentioned. They are sincere about these issues, but we've got to keep at it. I think one of the things that we have to focus on, and the racial justice proposals that were passed in November will help us do this. 81% of New Yorkers said we need to begin to measure the true cost of living in New York City so that our policies, our programs can be informed by that. You cannot solve economic deprivation. You can't deal with the issues that people are presenting with, poverty, stressors, and the like, by just centering on human services alone. We've got to take care of that, but we've also got to address economic insecurity in this city. People are made all the more vulnerable because of economic insecurity. Maybe creating a true cost of living measure and then developing policies on that basis will help us get there.
Okay. I know you know a lot of people at City Hall, so I assume that this will be heard and perhaps even acted on.
Good people.
Yes, good people.
Work to be done.
Thanks so much for coming by tonight. Good to see you. Let's take a break now. When we come back, as Mayor Adams tries to limit how long adult migrants stay in shelters, you're going to hear from City Council Deputy Speaker Diana Ayala to talk about that and the City Council's recent override of the mayor's housing voucher veto. Stay with us.